important. The opinions expressed in this video are the interviewee's own and do not necessarily reflect the view of Stakeholders Limited, trading as Earth Capital. This interview, like our service, is not advice. The investments described are high risk and illiquid. Stakeholders Limited is an appointed representative of Palace Ventures Limited, which is authorized and regulated by the Financial Conduct Authority, FRN 433291.
Hello everyone, welcome to another episode of Sustainable Conversations. Today we have Fungai Ndemera with us, founder of CheckUp Health. So let's kick off and say, Fungai, if you're happy to tell us a little bit about yourself and what key challenges within the NHS inspired the creation of CheckUp Health, and also how your solution aims to address these pressures. That would be great.
Thank you so much, Flo, for having me. Always a pleasure to be on one of these podcasts. I am Fungai Ndemera. I am a founder of a product and a company called CheckUp Health based in the United Kingdom. And I'm very passionate about health tech. And my background is actually nursing, believe it or not. I qualified as a nurse in 1999. And it's amazing that this background experience that I had when I worked as a nurse on doing bedside nursing, back then I realized that there were so many gaps. But I wasn't sure how these gaps were going to be relevant in my future journey. And so from that very beginning of my nursing journey, I kind of developed a deep commitment to tackling health inequalities. And these health inequalities, you could see them in subtle ways where you've got patients coming to access services and they've got, for example, language barriers or accessibility barriers. And these barriers, they do create gaps in our ecosystem, especially in the care delivery. And so, yeah, that gave me a kind of good background to become one of the people who would think about in the future serving the underserved communities. And CheckUp Health was really born from that background, which I've just described. And then later on, I think it was born out of frustration and feeling helpless, but also from a place of hope, because in 2004, I lost my father-in-law and my father a week apart. They were both non-hypertensive patients, but they died from undiagnosed diabetes. And I felt that the system was failing too many people, and we needed to be the hope that we desire. And so that really pushed me to thinking about how was I going to be part of, the solutions to solve these accessibility, equitability, and deficiencies within our ecosystem. And that's how, the idea of CheckUp Health was really born.
That's fantastic. Thank you, Fungai. And I think great to hear, that this really came out of a problem that you saw yourself within accessibility from your own experience and your experience with your father and your father-in-law. And obviously accessibility is really a key driver then for CheckUp Health and what you do now. I think it would be useful if you're able to share a little bit about what you think the key challenges you faced have been in scaling a clinically safe tech-led solution within the NHS framework. What are the challenges you found there?
Wow. So developing a solution and bringing it into the NHS ecosystem has been an amazing journey, both of learning, but really major challenges. And now when people talk to me about NHS and say, oh, NHS is very complex, I now totally understand, because NHS is one big giant organization, but with so many facets that don't really sometimes speak to each other, but that are really relevant in terms of when you are introducing tech solutions and solving those problems. And then coupled with the challenges with clinical assurances and integration. So currently in England, our healthcare ecosystem is made up of primary healthcare, secondary healthcare, and tertiary healthcare. And we all first have our touch points from primary healthcare, where we go and see our GP practitioners. And we expect that when our practitioners have seen us, our records and our information, we kind of imagine that it's going to be in one big repository, where if acute services wanted to see information about my primary healthcare information, they should be able to easily see it. But it's not been like that. But I'm grateful that NHS England, they took a step post-COVID when they introduced the contract, which they announced that they were looking to have new market entrants who would develop solutions from scratch. And that was going back in 2021, 2022. And when they introduced this contract, we were part of the companies that applied, and they chose about 8 companies to develop these core solutions from scratch. And so our journey has been a journey of 18 months at the beginning. Initially, we were supposed to produce a minimum viable product. But during those 18 months, I realized that the key was to be resilient. If I can say one keyword, resilience is everything, because NHS teams are so different. We had to do more than 75 integrations into the NHS core systems and making sure that our solution is cloud-based and it's interoperable within these three services that I've just described. And so that was a big, massive task. But NHS England made it easy and possible for us by providing a team for each of these integrations. And one thing that I think that could have been improved was if these 75 integrations could have been led by probably one team, but it's not possible because NHS England is not like that. So that makes it really complex, but it is achievable when you have got a small agile team which is resilient and wanting to really to have a product. And I can safely say we're able to have a signed off minimum viable product by NHS England, which is now interoperable with NHS spine systems, and looking to now go to first of type pilots with GP practices. So those challenges, they can look a mountain, but I think if you tackle them one bite-sized chunk at a time, you would be able to then work your way up and ensure that you are going through all the clinical safety assurances with each team and just take the challenge.
Yeah, amazing. And as you said, a really a massive challenge given the nature of the NHS, how big the organization is. But obviously having that central place for patients is so important in terms of the care that they receive. And so it's really fantastic to see kind of what CheckUp Health has done so far. And, as you said, you've been very resilient through the process and it's really paid off, which has been fantastic. That's great. And obviously, how do you think you would look at balancing public sector partnerships like Innovate UK or the NHS with plans for commercial growth? How did those two really work together in your eyes?
I really believe that balance is central to our strategy because public sector partnerships are very important because our health system in the UK is public led, right? And so having organizations like Innovate UK becoming catalysts in your journey is very important. For when I look back, the Innovate UK project that we did for us to run a pilot for remote health monitoring hypertension diabetes was very critical, and it was a catalyst in catapulting us to then landing a contract with NHS England. So I think that they helped us build they helped us build responsibly. They allowed us to test rigorously, and that meaningful collaboration meant that we had access to the right clinicians and the right people who would help our product shape and get that initial feedback that we needed from those public bodies. So if you are introducing a health tech product in the UK, you definitely have to have collaborations with the public bodies because then you've got access to the expertise that you need and the support to help you co-develop that product. And because CheckUp Health has been co-developed with NHS England, it means that the partnerships we have with GP practices and ICBs are important and at the center for us to have access to patients. And then those patients are the ones whose problems you're solving for their accessibility and for their trust. For us, we are saying that the patient group that we're targeting, that demographic, they don't trust the central systems. They have got language barriers, and they also want to test your product to see if it is designed for them and do they feel that it's for them. So access to those patient groups, you can only manage that when you've got access to the public led collaborations.
Fantastic. And as you said, it's been quite a journey working with the NHS to this point where you are with the product. But actually, in terms of future commercial growth, you're so much better positioned for that now because you're so well integrated into the NHS systems. You have, the relationships with the GP practices and the ICBs. And actually, it's hopefully allowed a much smoother journey coming, and less hurdles to climb. So that's really great.
Absolutely. And I also wanted to add that, the commercial growth strategy. So once we have got our product embedded, if you like, and really integrated to NHS main core systems, it means that the product is now positioned to also have consumer product and service providers from the private marketplace. So let me give you an example. So you've got patients who are seen within the private space, and their information and their records is not directly communicated back into NHS England. So if you went and seen your private GP and you had a private operation done, and those results and those outcomes of that procedure are sitting with your private hospital, right? But our solution allows these private players in the marketplace to now have access points and access doors via APIs, where they can come and also have their data feeding, reading and writing into that data. So we have got what we call the IM1 integration, which allows consumer products and consumer service providers to really come and have access to the patient information within the NHS. So we are streamlining and making sure that patient data is stored in one place, but also patient experience is much better. So when you go back to your GP, you expect your GP to have all the information of the procedure you've had done in the private space. And so, yeah, we are welcoming conversations with private companies for such conversations, for us to have those commercial models that will allow for that kind of service provision. So it is an exciting time indeed.
Fantastic. And yeah, absolutely. I think, the centralized system is so vital for patients and their care. And I know you've spoken a lot about the kind of accessibility issues. That's something that you're looking to solve with your CheckUp Health solution. It would be useful to understand a little bit more about how CheckUp Health is using AI and multilingual tools to improve access to primary care for underserved communities. So if you could speak a bit about that, that would be great.
Yeah, so when we talk about accessibility, there are areas that we currently chose as a company to look at, because accessibility is not just about access to appointments. It's about understanding and trusting the system that whatever I'm using as a tool is going to serve me as an individual, right? So we are using multilingual AI triage to break down the language barriers and the literacy barriers. Patients can engage with the platform in their own language. They can book an appointment, they can chat to a doctor, and through channels that are familiar to them. So you can chat via WhatsApp, via SMS, via email, whichever method that works for you. But in the background, our AI triage platform is also fast tracking or automating some of those processes and learning and understanding as well. So we are introducing machine learning in the background. As those conversations are going, there is learning that is happening. So our AI helps flag high-risk symptoms, direct patients to the right care pathway, and automate admin for GPs. The automation admin for GPs has been a game changer, because at the moment, the GP practices that we implementing the solution, they used to have multiple screens and multiple logins to log into the system. And also they had too many clicks to do to service a patient. And with introduction of the AI triage, it means that they are able to reduce number of clicks, and some of the some of the clicking is already pre-populated and pre-done in the system. We will be working with AI specialists that are already approved in the NHS. So we are not an AI specialist, but we've partnered with an AI specialist who are focusing specifically to AI and having their tools clinically safe and clinically approved, and we are integrating. So collaboration again is playing a very big role in what we are doing. But we find that for communities that often struggle to navigate the NHS, especially our elderly patients with disabilities, it really makes a real difference in their lives,
Absolutely, I can totally understand that, and I think bringing in these kind of these tools, these integrated tools like AI, you are streamlining the process, making it more efficient, not only for the GP practices but also for the end patient. And obviously, the patient is at the core of everything that you're doing in terms of ensuring that they have the access and support that they need. That's really great, Fungai. Thank you. I think it would be useful just to end on a little bit about what your main priorities for the next phase of growth are. I know you've done a lot of work so far, and how additional funding would support those goals.
Absolutely. So we are really excited because this is the most exciting time ever, where we have already got the minimum viable product signed off by NHS England. We've already got into commercial space now, because NHS England is already providing funding for sustaining the product for the rest of the contract, which is absolutely amazing. So with that incoming revenue, we are able to now implement the first of time. It means we are having 2 pilots with 2 GP practices. And because currently in NHS primary healthcare, there's 2 main systems, we are looking at running pilots with just 2 GP practices who are using different type of system each, so that we learn, we understand, and then we implement quicker. And the feedback that we've been getting from patient groups has been absolutely amazing. And the feedback we are getting from the GP practices that we've visited so far, because the key is to learn what are their current pain points and then make sure that we improve those pain points with the new solution when it goes live in real life in 2026. So we're looking forward to fundraising so that we can fast track this process that I've just described for you, but also quickly add numbers of especially our clinical decision makers and our clinical safety officers, because the solution has to be clinically safe. So currently, all our products are currently led by clinicians who are GPs themselves within the ecosystem. They understand what clinical safety is, and they are currently rigorously testing the system to ensure that the pilots are safe, they are effective, and we get the right outcomes that we want. So expanding the team to ensure that we do this and target to complete this before end of 2025, and then hoping to go live with the actual solutions in real life environments beginning of 2026 will be absolutely amazing. So that's kind of the goal. And then after we've done that, we will have done the main work. So after that, it will mainly be implementation and acquisition of GP practices. And we are receiving lots of amazing expression of interest from GP practices because our solutions are cloud-first, they are quick, and you can work from anywhere in the world using just a YubiKey. Our doctors, it's a game changer for them. So they're really excited about it, and we look forward to changing the face and the feel of primary healthcare.
That's fantastic, Fungai. Thank you so much. CheckUp Health is obviously at a really exciting time, and we really appreciate you coming on and chatting to us about CheckUp, but also the NHS and the problems you're trying to solve in more detail. So thank you so much. It's been great to have you, and we will hopefully see you again soon.
Thank you so much, Flo, for having me. See you soon. Bye-bye.
Recorded August 2025. Important. This video is directed at, and intended only to be used by, persons in the UK who can self-certify as high net worth or sophisticated investors. The information in this video should not be construed as investment or tax advice, nor a personal recommendation. You should not make or refrain from making any decisions based solely on the content of this video. If you're unsure an investment is right for you, please seek professional advice. The investment products discussed are not for everyone. They are generally higher risk, less liquid, and require a longer investment term. You may get back less than you invest. It is therefore important that you understand the risks before investing. Tax benefits depend on circumstances, and tax rules can change. Past performance is not a guide to the future. Where past performance is mentioned, annual performance data can be provided by Earth Capital on request. Stakeholders Limited, trading as Earth Capital, is an appointed representative of Palace Ventures Limited, which is authorized and regulated by the Financial Conduct Authority, FRN 433291.